Now we are recording. So the two concepts that I addressed here is that nobody can work as a doctor in United States without USMLE. And the second concept that I addressed is that USMLE is not a very difficult exam, but it's a standardized exam which is very well made, and it is made to measure what the examiners wish to measure in potential candidates who will work in United States as doctors. The third fact that I mentioned for you was that you must be scoring 80 out of 100 correct answers in order to qualify the exam, in order to be able to say that, yes, I will pass the USMLE. Now, when to give USMLE is a very common question. I have just 5 minutes, so I'm going to address the commonest questions that people ask. If you are from a medical college that has the integrated medical system, which means that there are modules like respiratory module, cardiovascular module, because I know that Khyber Medical University, Peshawar Medical College, all these institutions that I'm familiar with, even I think Dow University of Health Sciences has the integrated modular system. If you have that system and you are studying pathology and pharmacology in the first 2 years, or at least in the first 3 years, you can give step one in your third year. And for that, you need to have the National Board series, the NBME as they call it, and the books that are used for USMLE handy, and you need to study your subjects from there, and you can attempt the exam in your third year, and you can actually score very well in the exam, because step one is all about pathophysiology, and then come the clinical sciences, and so many other things, the ethics and the affective learning, and the clinical knowledge. And that is step two, which you can, if you are in an integrated system, you can appear in step two at the end of your final year, when you give all those subjects. Most of the medical schools will take a lot of subjects in the final year. So as you prepare for them, you can prepare for USMLE, you can prepare for any clinical exam for that matter, and you can appear in the exam in your final year. One big catch is how good is the clinical exposure that your institution is giving you, because step two is a theoretical exam. They will test your knowledge about internal medicine and pediatrics and gynae and all that, and from a pathophysiological point of view. But the thing is that it is beyond diagnosis. It is into therapeutics. It is not just diagnosing the disease, it is actually being able to treat the disease. So, for that matter, I think institutions where the clinical exposure is weak, it is wise to appear in step two after your house job. Which takes me to the next question: should we do the house job or not if we are appearing in USMLE? This is my personal opinion, and this is what I have always advised to my students in Pakistan. Absolutely, yes. You have to do your house job. There are no two ways about it, and there are pathways in USMLE that require the medical registration from the home country, which is the PMDC for us. And PMDC will register us as medical practitioners only if we have done our house job. So there is no two ways about it. That is the second concept. Um, so somebody is asking any age limit on the number of attempts. I think once you have appeared in one step, you have to give the next step within 7 years. Number of attempts, I am not sure, because this policy was changed once. That number, if you actually fail the exam, you can appear in it again, but there's no way that you can actually appear to improve your score. And again, there is no age limit. There's no age limit in step one and step two. I don't think so. Unless it's the retirement age limit, which is maybe 65 or 70. And people, yeah, absolutely. Dr. Hashmi is writing that it's never too late, and people get their fellowships even at the age of 55 and even beyond. I have seen older people. So there is no age limit. I'm going to just leave it open now. I'm going to go to the chat box, and I'm going to begin answering the questions. This is all that I needed to share. So What score is best? Bache, the best score is the best that you can do. And I told you that 80 out of 100 correct answers is the minimum, is the bare minimum. So if you're taking a dummy exam like the U World or a practice exam or the NBME, you should be scoring 80 out of 100. Okay. My age is 29. Can I absolutely, I mean, you're a baby. So yeah, you can appear in the USMLE steps now. And I explained the score for USMLE. It is never too late. Any age limit? No. Again, just a recap, ma'am. It's being, yeah. So I just recap. Um, so everybody is very happy to see me. Thank you so much. I'm very happy to see you as well. Okay. I am planning to do USMLE with my son, who will be entering medical school, and this is Dr. Hashmi. So all the best. I will be very happy to help you in any way possible. How can we get electives in US? Bache, you can very easily open Google. Google is just our best friend. And you can
Alia,
search the
Alia.
universities. Every big university, all the big universities in
Hi.
states have very nice websites. And go to the website and they have
Full time.
separate sections on electives. Okay, if there is a crosstalk, kindly mute your mics,
Ma'am, sorry,
because
ये
I'm
I
answering.
think you can. I'm sorry, you can mute all. You
Yeah,
will just
yeah,
put it mute
exactly.
all, and everyone will be muted.
Yeah, I just wanted to do that. Yeah. Okay. So, um, so getting an elective in US is applying for the elective. Go to the elective tab on the website of the medical school. For example, Toledo Medical College of Wisconsin, something in New York, whatever, State University of New York. Go to their websites, go to the medical school website, click on the tab for electives. It will give you a form. You have to fill the form. They have requirements of immunization, of medical clearance, many things. Apply for an elective and go through the experience. A second way is, which is very frequently used now, because all the medical schools have their associations in states. So, like for example, there is KMC ANA, Khyber Medical College alumni of North America, and then KEMKANA, King Edward's Medical College alumni of North America. So, if you know the alumni society of your medical school, you can just apply through them. Ask them. They are consultants. They are academics. They are in faculties, and they will be happy to guide you. There is Association of Pakistani Physicians of North America, which is APNA, very famous. And you can, go through their website and see what is available there. They're very, very affectionate and helpful towards students from Pakistan. Is there any scholarship for electives? No, there is no scholarship for electives. It is a completely personal endeavor. If you want to come to states for an observership for looking at what they're doing, nobody is going to pay you a scholarship for that because it's not a degree, it's not a certificate. What is the future of a neonatologist in USMLE? The future of neonatologists has always been bright in USA, but Jay, like you are asking, the even it is very bright in Pakistan now. But I mean, you have to go into a field that you like, and most medical fields have quite, they have brilliant futures. What is the process of applying to specific specialty? So once you have done your step 1 and step 2, you apply to ECFMG, which is Educational Commission for Foreign Medical Graduates, and you get a number from them. They send you a certificate, which means that your MBBS degree is now equivalent to an MD degree in United States. And that ECFMG number is your, like, your CNIC, your NADRA number to apply for foreign residency or to apply as an international medical graduate to US residencies. Specific residencies are all available online. There is there are websites for National Resident Matching Program, which is NRMP, and you can apply through them. And I mean, doesn't take much. You just search Google how to apply for internal medicine, how to apply for pediatrics, and it will guide you. Hello, madam. How about an Irish trained GP? Can I work through a competent pathway in USA? Okay, now these are specific pathways. If you are trained as a GP, first and foremost, you have to clear USMLE. There is only one state that I know, which is Tennessee. Memphis is a famous city in that city where Elvis Presley came from. So, sorry. So, Tennessee is currently suffering from a very huge deficiency of primary care medical personnel, primary care doctors, and they need family practitioners, they need primary internal medicine, OBGYN, pediatrics. So they have made a pathway where people can, again, people have to have USMLE step 1 and 2, but if they're not licensed in United States, like they haven't done the step 3, they can still get a job in Tennessee. And then there are ways of getting that medical licensure in United States. You have to work for a certain number of years in United States, and then you can move out of Tennessee and go somewhere else and apply for a license. So that is the only way. I have 5-year work experience as a specialty doc in UK. Does it help? Dr. Saab, the only thing it is going to help you is to have very good knowledge. So steps are going to be easy for you. And secondly, when you apply for residency, you're going to have a big edge that you have specialty experience. Or you can apply for fellowship if you are in a highly specialized specialty. For example, if you're a vascular surgeon who has a lot of experience with carotids, I'm just giving examples. I mean, these words may be changed with other things. But if you're highly specialized, you can apply to fellowship programs. And they can give you an exemption from residency and they can get you into a fellowship, but you have to clear your steps. There is no exemption from that. Ma'am, how do we start USMLE prep in third year? Which subjects are important? Acha bache. Number one, go to any website where there is guidance about USMLE. First of all, find out what subjects are tested in step one. Okay. So yeah, Dr. Hashmi, did you have a question?
Madam, sorry. No, no, no. I have a good way for all the people who are in any year of this of their medical student life. Okay,
Mhm.
it's like, for
Mhm.
example, if you are in first year, I will highly suggest you to start reading whatever you are reading from whatever source you are reading. Start,
Exactly.
just have a taste as a sweet dish of the Kaplan and the U World MCQs books. This will give such a good addition to your knowledge that no exam will be difficult. This is number one. Number two, if you are lagging behind, like someone wants to start that thing in year three, they can just what they can do is then when they are doing pharmacology, for example, they can just revise the physiology and anatomy, so that later on when they are doing pathology, they can add that subject, and by the time they are reaching final year, they will be all set. Another thing is that some people rush for USMLE in fourth year. It's not necessarily that if you are able to prepare yourself, like, yes, like prepare yourself like a marathon. Okay, if you are prepared for a marathon race, it's just matter of few months and you can appear in the exam. So rather, if you have done final year MBBS, it will be helping you in having a better understanding of some of the clinical questions which may be asked in even in step 1. Like your clinical knowledge will be multidimensional, and I give this idea to a number of people that you can just do that. You can have system wise just the pattern of the first aid, that you can combine, rather than reading one book from one page to last page. You can make it in the systems. Like if you are reading CVS, you can just start from the physiology, pharmacology, clinical anatomy, pathophysiology, and then medicine. So it will be giving you a very good concept. This is one thing. One more thing, madam, I am telling. I will want. there are some people who are asking questions with reference to fellowship and residency, because there is a lot of confusion. Nobody knows about fellowships. Majority of people don't know. So actually, if you have got experience before, you can directly apply for a fellowship. Okay. And like that will be easier, because maybe you are not getting match in residency, you can get a fellowship. And later on, if you are good in fellowship, either you can continue your position by doing some fellowships. One of my colleague, he did USMLE, he got fellowship in advanced airway anesthesia. Okay. And now, because he was so good, even after 1 year, he has been offered a faculty position, and he will be working after 1 year as a consultant. Okay. So that will open up the door. So it's never too late in USA. Even I'm optimistic that even after 4 5 years, maybe I can go there, inshallah. That's what I wanted to.
Yeah.
So it's never too late. As much your experience will be, this will actually add on to you. And actually, the people who don't get the residency, they don't tell the real reason. There is not even one reason for not getting the residency. They are not able
Yeah.
to satisfy the board of the interview, who are taking the interview. And there are so many reasons, like one of them will be the electives, research, their USMLE scores, overall their personality. If they are not able to convince you, then
Yeah. Thank
hospital,
you.
maybe
Thank
why
you.
will they select this?
Thank you, Dr. Hashmi. I have Dr. Saleh here who has raised a hand. So, yeah, go ahead,
Assalamu
Dr.
alaikum.
Saleh. Ask. Walaikum assalam.
I'm a first year at Nishtar Medical University, and I recently heard about like a USMLE Step 1 being pass fail, right? And the person that told me, he went like, they look at your med school transcript. Now, I just wanted to confirm that. Do they, or is it just like wrong information?
No, medical school transcript has nothing to do with USMLE pass or fail. USMLE pass or fail is USMLE pass or fail.
No, no, I mean like for residency matching, they're gonna
Yes,
look at
they
your
do.
med school
Absolutely,
transcript.
they do. Yes, your medical school transcript is one of the major requirements of documentary evidence that you furnish when you get into a residency. That is after passing the step one and step two. Okay. I'm going to go back to the questions because we're accumulating them very quickly. Madam, how do we start USMLE prep? Bache, USMLE prep step one is basic sciences, pathology, physiology, biochemistry, anatomy, very little anatomy, behavioral sciences, and all the exam is based on pathophysiology. That is why I told you in the beginning that if you're, and just like Dr. Hashmi said right now, that you have to study in, so I'm going to mute all because somebody's singing. Okay. Just like Dr. Hashmi said, that study the physiology, anatomy, biochemistry, pharmacology, and pathology of one system at a time. That is the integrated system. Unfortunately, not many medical schools in Pakistan still have this integrated system rather than the integrated system. We can try to share some links of the hospitals as a sample. Okay, I will try and share, or I can share them in the group. There are so many links for that. I have done FCPS. Should I go for USMLE, or is there a way for second fellowship pathway? FCPS candidates, बच्चे ऐसा है that you have to go through USMLE step 1 and step 2 have no exception. Unless it is a highly specialized specialty in which you have a lot of research experience, then there is a pathway where they take you as an O candidate, which is the outstanding candidate. And you have to prove that what you have is something that nobody or very few people in United States have. So you don't want to do a second fellowship from Pakistan. You need a good mentor. You need connections in United States to get into a fellowship. And my advice is to appear in step one and step two, and then apply for the fellowship, just like Dr. Hashmi just said. Okay, I am from King Edwards. There's a doubt about electives. If someone doesn't do electives, how does it affect? It doesn't affect at all. You do your electives from any good place. I mean, you are from King Edwards, and I remember that King Edwards students used to get electives, and they used to come to states and do the electives. I am from Aga Khan. I got electives in Albany, in New York, but I went to Peshawar, which is my home city. I did my electives there. And I got very good recommendation letters. And honest to God, those recommendation letters really helped me in my residency, because those pediatricians were known to the people who were interviewing me here. So it's, it doesn't affect your USMLE journey. Where there is a will, there is a way. If there's khair, Allah will, inshallah. Dr. Hashmi's nice, kind advice. What is the use or benefit? Number one, but your electives prepare you for a different environment. If I am interviewing you, I will say that this kid has left his medical school, he left his city, and he went somewhere else to get this experience. So he must be really interested in this subject. Then, if you do electives from states and I'm interviewing you in states, I will know that this kid has, he has already seen the American medical system. So that gives you a big, big edge over other foreign graduates who are interviewing. Okay. We have 10 minutes now. If I suddenly disappear, join back through the same link. It will open doors to get fellowship in USA. Yes, I agree, Dr. Hashmi. Is it easy to find externships? Yes, it is very easy. I mean, with all the, sorry to say, but with all the Desi population of doctors in United States, and especially now with the paid epidemic of observerships, it is very easy to find it. You just need contacts. Please don't go for expensive, externships and these things. Use your contacts. Go through somebody that you know who will recommend a friend who will help you do an observership with them. Okay, so there is a kid here. I'm from the US. I came to Pakistan to pursue MBBS. So is the process different for us? Yes, Bache, you have a US passport. You are a US IMG, which means you are a United States citizen who is an international medical graduate. So you have a much higher chance of matching. If you have good steps and good scores, a foreign IMG, which means a Pakistani passport holder or somebody else other than US, has a lower chance. So you have better chances of matching in United States. Um, is this a thing that people who have graduated more than 5 years? Yes. Everybody likes fresh graduates. This is common sense, bache. It is not that it is impossible, just like Dr. Hashmi so nicely, made it clear for you. And United States is a country of opportunity. So, grab your opportunity at whatever age, but know your odds. And of course, fresh graduates have higher odds of matching. So thank you, ma'am. Thank you, ma. Can you get training in anesthesia? I'm already a consultant in anesthesia in Ohio University. So if you're already in Ohio University, then I don't know why you would pursue training. But yeah, if you're already in training and you are an anesthetist, further training should be easy for you. If you are an anesthetist in another country, okay. So if you're an anesthetist in another country and then applying for training in states, once again, it depends on your experience and it depends on your USMLE scores. So even for second fellowship, steps are a must? Yes. Steps are not going anywhere. It is best to give your steps as soon as you can. And it gives you a lot of opportunity. It opens a lot of doors for you. Assalamu alaikum. Walaikum assalam. I'm FCPS Peds surgery. Post step 2, one gets ECF. And as per my search, US offers international fellowship. Yes, it does. There are some centers that offer global or international fellowships. So my question is, post fellowship as an international candidate after one's primary fellowship in your primary country, what are the opportunities for getting license? Just like Dr. Hashmi said, once you have done your fellowship, maybe you can opt for a short pathway residency, for example, a 3-year residency, but you will only need to do 2. You will give your step 3 and you will apply for the licensure in the state where you are a fellow or where you are working. The thing is, if you go as an international fellow, there are requirements of your visa to go back to your country of origin for 2 years before you can come back and work in United States. So that is one rule that I know for international. That's how I was. It's a J1 visa. It's for 7 years, and you have to go back to the country of origin, and you have to serve there because you have gone as an international fellow, and you have bypassed certain pathways to tell them that I will specialize and go back to my country. Salam Walaikum Salam, doing my house job. Interesting given step one does not have any guidance. Bache, you need to look for guidance because it is all over the place. It is in your school, in your hostel, in Google, um, in Facebook. It's everywhere. Just have to look for it. New now house job is not essential. So should again, bache, no way. You have to do your house job. There is no exceptions. Assalamu alaikum, ma'am. Okay, so we're going to disconnect in 5 minutes. We need to come back. I'm going to quickly go over these questions. I have a question regarding residency in US. Stop sending questions. If you have more questions, then send it in the next session, okay? Because I'm going to miss those. I have a question regarding residency in US. Do doctors come back to their home country? Yes, of course. I'm the only child. I went back to Pakistan after 7 years of working in US. I worked there for 20 years. I'm very happy. Alhamdulillah. And then my personal opinion, it depends on your family, on your situation, on your vision of life for yourself. My vision was to go back to Pakistan and teach. So I went back and I taught. And Alhamdulillah, I had a good experience. Depends on many factors. Overall, worth it to come back to home if not pursuing USMLE. While you can work 15 days in US and 15 days in your home country after internal medicine. Okay, steps are must. Steps are must. Steps are not going anywhere. How many research publications? As much as possible, but at least one or two. Okay, just to in the first time when you are interviewing. My specialty is pediatrics. Good for you. Where do we study? Third year pathology, Pathoma or Robbins. These days, everybody is doing Pathoma. In my time, it was the essentials of pathology, the medium-sized Robbins that we used to study. These days, it is Pathoma. I know that from my students. Is it easier to match for pediatrics if you yes, it is. Absolutely. Indian MD peds are so well liked. Okay. Assalamu alaikum, walaikum assalam. About myself, done MBBS 2013, FCPS anesthesia. If I pursue USMLE, securing average scores, possible things that can happen. Um, Dr. Saab, you have extensive experience, so you have a big edge. If you clear your USMLEs, you can apply for a residency here or even an advanced fellowship, like Dr. Hashmi mentioned, and you have a good chance to get in. Assalamu alaikum, wa alaikum salam. Ask about myself. Okay, so it's the same question. And then Dr. Hashmi has answered, of course, if you are a statist. So he's the best mentor here. Alhamdulillah. Thank you. Most welcome. Can we enter anesthesia residency without USMLE? No, no. Like I said, no way. You have enough experience, enter via fellowship. So Dr. Hashmi is answering now because he has explored more than me. I don't know of a lot of alternative pathways. I'm sorry, but and they are really exception. They're less than maybe 10% of the total residency spots. Guide us about PLAB. This is not a PLAB session, bache. This is about USMLE. So that is what I'm going to talk about. I don't have experience with PLAB. I'm an American graduate. Are there free
Ma'am, sorry
electives?
I'm sorry. This question which was asked by alternative pathway, I know one person who was very committed, and he got a residency in anesthesia while he was doing FCPS training in Saudi Arabia. Okay, and actually he was the one who used to say me, please don't do these exams, go do USMLE, and I did not listen to him at that time. Around 10 years ago when I did my fellowship, I was involved in the British and Irish exams. Unfortunately, I didn't do it, but anyways, it's never too late. That's what I say. And actually, this fellowship pathway is open for everyone. If you are good, yes, it is easy that you should go there, do an observership so that they know you, and then it will be easier for you to compete and get the position for fellowship.
Okay, so just one thing. This is the last thing. Then the session is going to disconnect and you can rejoin through the same link. Dr. Hashmi, what you are describing is all in anesthesia. So I would not generalize it to other subjects because I have worked in pediatrics, then in neonatology, and then somebody is asking me, "आप US में कौन सी post पे हैं?" I'm not on any post in US. I graduated US more than 20 years ago. So, it's very difficult to generalize it. It's very difficult to generalize it to others, especially clinical disciplines like pediatrics, internal medicine, general surgery. Those fellowships are very hard to get in. And even, if you know one example, it is very hard to generalize. I'm going to end the session here, and then you are welcome to rejoin through the same link.